Liam Payne is one of the members of the supergroup One Direction, and he's unquestionably a great-looking guy. But heads returned when he appeared at a London movie premiere this month, looking very, very different. Is it plastic surgery? I'll give you the answers in the next 3 minutes. Before we start, I need to say that I am not Liam's doctor, so everything in this video is just my opinion. Liam Payne rose to prominence as a member of the music supergroup One Direction. The fresh-faced young man has always been regarded as a sex symbol and a really good-looking guy. Now, if you look at photos of him from 2017, 2018, and 2019, you'll see he's always had a bit of a squared-off jaw, and this area of the jaw is called the angle of the mandible. In this photo of him from 2019, you can see that he has a bit of a soft, filled-out face that looks masculine yet youthful. Fast forward to 2021 and you can see that Liam's face looks a little fuller than it did back in 2019. So what could cause this increase in volume of his face? Well, gaining a little bit of weight can definitely do it, and depending on the person, small changes in weight can have fairly big consequences to how a face looks. Injectable fillers can also make a face look fuller, as can medications and reactions to medications like allergic reactions, but I doubt that any of these apply in this instance. Most likely he just gained a few pounds in 2021, like so many of us. No big deal, he still looks great. Now let's fast forward to January of 2023. You can see that Liam's face appears to have slimmed down a bit, and he looks a little more like the Liam that we remember from 2018 and 2019. And 2 months later, he shows up to a London movie premiere looking like this and like this. Huh? So let's break this down. Now his face has gotten more chiseled looking in a mere 2 months. His cheeks look thinner, and we're actually seeing more definition pretty much everywhere throughout his face. So what can cause this? Well, I believe that his face is basically just leaned out a bit. He probably lost some weight, and this caused his face to look thinner and as if it's lost volume like maybe the rest of his body. I don't think that he's had any facial liposuction or anything crazy like that. But if you take a look at his cheek hollows, you can see that they look quite a bit more hollow than they did before. Now this could once again be due to weight loss, but it can also potentially be due to a buccal fat removal surgery. And this is a small operation where we go through the inside of the mouth and we tease out a little bit of fat from the inside of each cheek. And it can cause this part of the cheek to look a bit thinner, kind of like this. But more than that, his jaw actually looks a bit more squared off and even a bit enhanced. I mentioned before that he normally has a square jaw, but this looks a bit more than that. Especially when he's smiling, you can see that his jaw looks like it's clenched. So what can cause such a big change in just 2 months? Injectable filler like the new Juvederm Volux can be injected in that area to fill it out. But I really doubt that he's had injectable filler, because then he probably would have had filler injected in other parts of his face, and it doesn't look like that. Now there is a muscle called the masseter muscle, and this is a muscle that sits right on our jawbone above the angle of our mandible. And when this muscle gets thicker, we call it masseteric hypertrophy, and it can kind of look like what he has. So anything that causes the masseter muscle to get thicker or to grow could be causing this change in appearance. So if he began chewing gum all day or grinding his teeth at night, then this can definitely contribute to masseteric hypertrophy or overgrowth of that muscle. There are even commercially available jaw exercisers that some people actually use to thicken the masseter muscle, and you bite down on them to grow that muscle. You can buy these things on Amazon, and I have absolutely no idea why somebody would do this. So I think the changes in Liam's appearance are probably due to a combination of weight loss, maybe a buccal fat removal, and overgrowth of his masseter muscles. Now weight loss may have contributed to Liam's face changing, but has weight loss contributed to all the celebrities whose derriere seem to be shrinking? Yes, we're talking about Khloe, Kim, and a lot of their friends. For some reason, butts seem to be getting smaller in Hollywood. Well, I break that down all for you in just a few minutes in this video right up here. And remember, eat real food, use clean skincare, and always wait before you operate.